Hello, my name is Kevin Horton, and this is my interview reflection video assignment. The class is Psychology 491. It's my capstone in psychology. My professor's name is Professor Nathan Roberts. Now, I was given the task to interview someone in the field of psychology or one that is closely related or is working in that field of psychology. And the person that I chose happens to be my mental health therapist. See, I've been working with her for a little over a year, and I felt that she was inspiring. She is well versed and she's well knowledgeable and has the experience to give me an understanding of the field in which I am currently pursuing my degree in. During one of our most recent appointments, I was able to ask her a couple of the questions uh, for the interview reflection video assignment. So, in this video, I'm going to give you the answers and responses to what she told me, um, how she felt about uh, the field of psychology and her profession. So her name, job title, and degree is her name is Dr. Alicia Emmett King, and she is a psychiatrist. She works with the VA, the Veterans um, Association Medical Hospital, Department of Veteran Affairs, the Veteran Affairs. She works in Columbia, South Carolina, and she also works in other locations in the field of psychology. Her field of study is psychiatry, sleep medicine, and internal medicine. Some of her job duties include conducting interviews, which lead to mental health evaluations. She also does psychological testing, and medical record annotations, and medical record reviews. She also creates tailored mental health treatment plans based on the patients that she interviews and their needs, and how she's able to diagnose them. She prescribes them medications and she helps manage mental health conditions and monitor the effectiveness of those medications. In all, she provides summaries of information to help her field of study and to support the patients and their families and help them understand and manage their mental health conditions. So I asked her to describe uh, what does she find fulfilling in working in the industry. She says that seeing a patient transition from feeling hopelessness to significantly improving their attitude and outlook on life, uh, the transition of a patient from, you know, coming in with all sorts of problems to her being able to work with the patient and be able to give them a treatment plan to help them get better, seeing them become better. And then she also says that hearing from patients, former patients, who have turned their lives around and who continue that success in the treatment plan that they were given, she finds that very rewarding. She also says that contributing to groundbreaking research to better help the profession has proven to be a great accomplishment of hers. So I also asked her to describe something that she finds challenging when working in the profession. She says things that could be challenging would involve balancing your patient care versus self care needs. Some patients and studies require long hours and enormous workloads, which can lead to feeling burnt out or exhausted. She says there are critical and severe mental health issues that can be more difficult to diagnose and plan a treatment for, as well as dealing with patients who are at risk of harming themselves or harming others. You see, she said it could be a delicate and stressful experience, especially when um, debating on whether to break uh, patient confidentiality, profession, client patient confidentiality. Like when you're dealing with someone who's at risk of harming themselves, you have to decide whether to break that confidentiality and inform someone, so that they can get further treatment or be able to find a safe solution to keep that person from harming someone else or to harm others. Um, so I asked her, what do you do to continue professional growth in the field? She says, as a psychiatrist, it is required to take continuing medical education and examinations to maintain your medical license. So periodically, you will have to take continuing medical educational courses, and you will have to take examinations to maintain your license in the medical field. And though it is also highly recommended that you attend conferences, workshops, peer-to-peer gatherings, and actively involve yourself in a membership of a psychological organization, a mental health organization. She said you can also subscribe to the latest medical journals and magazines or websites that, and they also release timely, updated information, and that is key to staying involved and always learning and gaining insight in what's new in the mental health field. Um, I asked her what's the recommendations for pursuing work in the field. For someone that's pursuing work in the field, what would her recommendations be? And she said, make sure that you continue to do full research and all the research necessary in order to make this decision to come into this field. She said, weigh your options, negative versus positive, when that impacts sacrificing amount of time towards the profession. As far as if you have a family life, you know, make sure you weigh the options, on spending this amount of time, to toward the profession. And not just talk to her, she said talk to multiple psychiatrists, psychologists, counselors, therapists, any other professionals related in the field so that you can go down the direct path in which you desire to achieve in your profession. So she's saying that, not only talk to her, but because the field is so diverse, you need to talk to multiple people in the field to find out what specific job you're pursuing and what's the pathway to get to that job, uh, to get to that type of career that you want to achieve. And in conclusion, she said, this is a very rewarding field. It's always in high demand. And anyone pursuing a career in this field, they will experience obstacles daily, but they will also be feeling a feeling of accomplishment and belonging daily. She said, when you take on this profession, you will belong to a small group of unique individuals. And it will show in the bond that you have with others in the profession, as well as relationships that will evolve when you deal with patients. So she said it's a rewarding field. She said, besides the fact that, you know, you're gaining knowledge and insight daily on mental health issues and all kinds of, uh, you know, getting away from uh, from, what's the word I'm looking for? Getting away from the stigma of psychology and the type of, I don't say rumors, but what's the word I'm looking for? What's the word I'm looking for? It's kind of like hoaxes, but like, getting away from what, the negative reputation about psychology, and how it's a field for crazy people and dealing with crazy people. But it's just everyone has mental health issues. Everyone deals with certain anxieties and things that they could find treatment for. So she said that you'll play a intricate part in being able to help those people get better, find ways and find avenues and build a bond relationships with not only your peers, your working peers, but also with the clients that you have. And she said, it's a great field to pursue, and she wished me the best of luck. Once again, my name is Kevin Horton, and this is my interview reflection video assignment. Thank you.